in respiratory problems, nowadays, most of us as a pediatricians, we have a problem that not responding cough. So, first thing in our mind, when and how this cough will begin. Is the cough an isolated symptom? If not, what type of association as fever, cold, or vomiting, or does increases after the sleep or in the midnight or early morning? What is the cough's character or quality? How frequently? What triggers the cough? At what time does the cough occur? Is there family history of respiratory or allergy disease? Do the parents or even adolescents, child smokes? Even grandparents also? Is there any environmental allergens at home, like dog, cats, or any of the birds to look after the feathers and all? What treatments were tried? What was the response? What medications, if any, does the child takes? And how old is the child? According to these things, if you take a proper history and then after the clinical examination, we can come to the conclusion of what type of cough or what is the reason for not responding. The cold cough always look for the cause than just suppressing the symptoms as infective, allergic, or any of the structural abnormalities like GRD, or even some of the patients may require an investigation also to see for the any fibrotic band complexing on the airways or any congenital cysts or tracheoesophageal fistulas and all, any associated congenital anomalies. Infective again is a viral or bacterial, and what is the reason for the repeated infections, and then treat accordingly. In colds again, rhinorrhea, the blocker's nose, or the sneezer or the snorer like adenoids, tonsillar hypertrophy, even bilateral turbinate hypertrophy with some of the children even having a DVNS, deviated nasal septum, or a sinusitis. Find out comorbid otitis or sinusitis. Treat complete inflammation, underlying inflammation, maybe in the nasal passage, nasopharyngeal, or sinuses, or even in the otitis. Again, for the cough, site of the lesion is very important, as a lot of children have the postnasal dribbling, and just after lying down or after snuffling like this way, or pharyngeal or adenoid obstruction, or lower respiratory as well as laryngeal, bronchial, or smaller airways, we have to see for which type of cough it is there. Again, types of coughs, cough with the distress, it may be a laryngeal or airway or at alveolar level like pneumonias and all. A kid's cough can be a sign of simple cold or something more serious that needs medical attention. Dry cough, also called a hacking cough, if it persists after a cold, it likely is caused by residual mucus that will eventually clear up. If the cough happens mostly at night, your child could have asthma. Mucus in inflamed and narrowed lung passages causes irritation that creates a cough. It is most common when lying down or after exercise, in cold air like in the AC, or after eating some ice cream or cold drinks, and when the child has a cold or allergies, like simultaneously the child can have atopic dermatitis also, or eye allergies, and like a rhinoconjunctivitis. Control asthma triggers such as dust, molds, they can be in the kitchen, on the food particles, or in the car, in the deep pockets, pollens and pet danders. If it's not an asthma, your child should drink plenty of fluids while the mucus works its way out of the system. Then green mucus cough. A cough with a lot of mucus or phlegm usually is a sign of cold, Especially the child also has a runny nose and sore throat. And if the cough is accompanied by a fever and thick, greeny or sticky mucus, it could be a sinusitis, sinus infection. If the child has had a cold and the cough is getting worse, it could lead to the pneumonia along with the fever. If the child is too young to blow her nose, we can use a bulb syringe to clear the mucus. And always, the patient should always sneeze out. They should not snuff in, otherwise it goes into the sinuses and even to the registration to the middle ear, and it causes more complications, and it takes a lot of time to clear it out because the underlying allergy or inflammation will take some time to clear it out. And after sniffing inside, again it will go into the sinuses, and specifically now as the allergy is increasing, the chronic inflammation has a lesser drainage into the mucus from the sinuses into the nose, and that's why again the blockage will happen, and it will take a lot of time, and the cough will not go because the postnasal dribbling will continue in those children. Even in these people, cool mist humidifiers or nowadays seawater nasal wash is there, that can be useful. Then third type is the wheezing cough. A baby or child who has a wheezy cough that sounds gurgly or raspy could have been an infection of the airways because of the respiratory syncytial viruses, parainfluenza viruses or influenza viruses. This specifically affects in the winter months. In the older child, that can be an asthma because of the pollens and the dust mites, they increase in the winter. Most of the viral infections, usually they go on its own, but these children will require intensive monitoring for the respiratory rate and any of the distress, and then we have to treat accordingly. If it's a flu-like, we have to give an anti-flu. Along with that, plenty of fluids, rest, and depending on the nebulization or immunotherapy, and symptomatically paracetamol that can be given. To avoid such type of infections, the vaccination is very important. Barking cough, fourth type of cough, that sounds sort of like a bark with a high-pitched whistle when the child inhales, could be because of the croup also. Basically, upper airway laryngitis or tracheitis. This barking cough or laryngeal cough is mostly between 6 months to 3 years, and some viral infections they trigger it, and it causes the inflammation into the upper airway, creating a telltale whistling sound. Then most common is in rural areas or urban slums, whooping cough. The sound of woof is there, which is a potentially serious illness. If the child is having coughing fits and making a whooping sound when he inhales, it can be because of some bacterial infections, including nowadays pertussis. The scenario has changed. Even in the adolescents, we are finding these cases. Those children which are not being properly vaccinated with the DTAP can have such a, and some of the bacteria also can have a woofing type of cap. And the woof or the cough is followed by the gagging or vomiting instead of a whooping sound. Then small children below 2 years, or specifically in the infants up to 12 months, bronchiolitis is the cause of cough due to viral infections. In some of the patients, it can be an acute first episode, but the underlying allergy can be there. We have to take a detailed history into the family. A few days, the baby has a breathing difficulty, the respiratory distress can increase. Some of the patients, secondary infections and all, can have a larger airway involvement with noisy breathing and fever. And if that started, the patient has a secondary infection. We have to treat accordingly. Pneumonia is also one of the cause of cough in children at all ages. And the infection can be because of the viral or bacterial infections. In those cases, as the criteria according to the age, the respiratory rate is calculated, along with the fever, the patient may be lethargic or sleepy or irritable, refusal of feed can be there. And accordingly, we have to treat the root cause, whatever the bacterial, then proper antibiotics. And if it is viral, some of the antiviral can be given. Rest of the time, symptomatically nebulizations and chest physiotherapy, the hydration has to be maintained.